Hi, I'm Dr. Amir Hannan, a full-time general practitioner at Horse and Thornley Medical Centres in Hyde. And we've enabled our patients to have full access to their medical records for the past 14 years now. And 66% of our patients now have full access to their records, and so they can see what the doctor or nurse has written in the records alongside the rest of their electronic health record. And one of the questions that patients ask, or people ask, is how do we go about enabling patients to be able to view their full electronic health record? Well, you can see me here in my consulting room, and you can see at the side I have two different screens. I have the clinical system over here, and on the right hand side I have a separate screen with the practice website on it, our practice-based web portal www.htmc.co.uk. And I do this very deliberately because I can turn the screen around to share it with the patient during the consultation, but I can also use this screen so that I can show them things that they can then do or look at afterwards. And on our practice website, down at the bottom, we have a section that says register now, and this is our consent process. It's a two-step process, and the first step is to get your PIN numbers from the front desk, which we're able to generate right here in the consulting room itself, or they can go and get that from the front desk from the reception staff. And the second step is they're asked to complete an online questionnaire. And in that questionnaire we ask the patients a series of questions which helps us to determine whether they can handle their own personal data and whether it's safe for me to do so. Because as a GP, as a data controller, it is my responsibility to make sure that it's safe for you to be able to do so. We make the assumption that everyone should be able to have access to their medical records, given that 90% of the population has already been online in the last 3 months anyway, unless we can find a good reason not to. And there are essentially two ways of being able to decipher whether there are whether there's a good reason not to. Firstly, it's because of their answers to the questions in the questionnaire, and secondly, if there's anything in the medical record that might suggest that this patient should not have access to their records or something in their past medical history. So, what's this questionnaire all about? Well, in the questionnaire we ask a series of questions relating to a number of different scenarios. So, if we just go through them. The first question asks, are you happy to use passwords to access your medical record? And you can choose to say yes or no. The next question, after you've been to the doctor or to the hospital, you can check if the encounter's been recorded and what was discussed. Do you agree this is a good reason to have access to your records? Yes or no? And then, would you like to be able to feed back what you think of the records access system? Yes or no? And then, there may be an instance when accessing your medical records, you may read some information that might be shocking or upsetting. What do you do if this happens and you can't speak to your doctor or nurse immediately? And you've got a variety of choices that you can make. You might choose to not look at the test results and wait until you've seen the doctor or nurse. Or you might panic and get worked up. Or you might want to look at some information on the self-care section on the practice website. Or you might choose to wait and contact the surgery the next working day. Or you might choose to ring 111 or the out-of-hours service, or go to A&E, or possibly some other choice that you might have. Now you might choose a variety of different options depending on what the issue was, and we enable the patients to choose which ones they would like to take. Or the next question, you see a new letter's arrived in the record, you open it up and you find it's about another patient in the practice. What do you do? You might choose to read it and then tell everyone else what you've read, or you might choose to inform the practice, or you might choose to stay quiet and not tell anyone about it. And then, would it upset you if you read something somebody else has said about you with regards to your health? Now you've got a few options there. No, you might not, it might not upset you. Or yes, it might upset you because I don't want this information kept in my record. Or, yes, it might upset you because you shouldn't believe what others say. Or, yes, this could destroy our relationship. Or, don't know. And you can choose one of those options to determine what you feel about that. And then finally, do you feel you understand what record access means? Yes or no? Now, this questionnaire we devised 14 years ago before I started with my very first patient, and we've continued to do that. And at our practice, no patient is given access to their medical records until either they or their carers have completed the questionnaire for them. And if they answer the questions, we can then look at those answers to determine what should happen next. So if a patient, for instance, for the question that says, what would you do if you saw something that was shocking or upsetting and you couldn't speak to the doctor or nurse immediately? If a patient chooses, I'd panic and get worked up, which is a reasonable answer, well, that would then trigger a further conversation with that patient. If they're in the consulting room, I'd be doing it there and then. But if they've completed it elsewhere and it's being processed, then either myself or one of our staff that we've trained would ring that patient up and talk it through. Now, if you've read something that if you're the sort of person who might panic and get worked up, then it probably isn't a good idea to be looking at your record on a Friday night after the surgery's closed. Why is that? Well, of course, because then you might then have to wait till Monday morning before you can actually see your records. So if you're that sort of person, then please don't look at your record on a Friday night, but you might choose to look at your record on a Monday morning, perhaps half an hour before the surgery opens. And of course, if you do that and you read something that upsets you, then you can be on the phone or contact the surgery when it opens to say, I'd like to speak to one of the doctors, nurses or receptionists or someone that can help them. There's an example of how the questionnaire helps to facilitate shared decision making. Or there's another one. What about if you read something that somebody else has said about your health and it upsets you? Well, that could happen. And if that does happen, what we advise patients is to contact the practice so that we can have a chat about it. Now, you might think that's not a very satisfactory answer because actually it's information that they're reading that someone else has given about them. But on the other hand, if we turn around and say we can't give you access to your records because there might be some information in there that someone else has said about you, then you're missing out on the opportunities of benefiting of accessing your records and having a better understanding of your healthcare needs. And so we've taken the decision to say there might be information there that you might see, and if that's the case, then please come forward and talk to us. And of course that applies to both the patient and also to the third party, the person that's providing that information, if they want to come forwards. In 14 years, we've never had a single problem with third party data, although of course there's a possibility there might be. But in medicine, there are no perfect answers, and it is about us trying to manage the risks as best as we can whilst trying to deliver high quality care. And the questionnaire is a very, very important part of that consent process that we have that allows patients to be able to see their whole records. If you have any further questions, please feel free to contact me about the questionnaire and how we've gone about doing it. Thank you.